Hello, my name is Sandra Robasi with the Bureau of Child and Family Health Data and Surveillance Section, and I will be going over the burden of asthma in Cuyahoga County. Here are the table of contents that will be discussed throughout the presentation, including some of the asthma disparities faced within the community. We will be going over some background information on asthma, the population demographics in Cuyahoga County, the asthma hospitalization and ED visitation rates, Medicaid rates for asthma-related ED visits and hospitalizations, asthma death rates between populations, and the key findings. Asthma is a chronic lung disease that affects people of all ages. Symptoms associated with asthma include coughing, wheezing, shortness of breath, and chest tightness. These symptoms are caused by the inflammation and narrowing of the airways in the lungs. However, with proper treatment and management, asthma can be efficiently controlled. This table further describes the population demographics in Cuyahoga County compared to the demographics reported in Ohio. Compared to Ohio, Cuyahoga County has a higher percentage of adults who obtained less than a high school diploma. Cuyahoga County also has a lower median household income and a higher percentage of the population living in poverty. Next slide, we're going to further look into the asthma hospitalization and ED visitation rates by race for adults in Cuyahoga County compared to Ohio. Throughout the 2016 to 2021 surveillance period, Black adults in Cuyahoga County experienced significantly higher rates of asthma-related ED and hospitalization rates compared to their white counterparts. In 2021, Black adults in Cuyahoga County experienced an asthma ED and hospitalization rate of 148.74 per 10,000 adult residents. Hispanic adults in Cuyahoga County experienced higher rates of asthma-related emergency department visits and hospitalizations compared to white adults both in Ohio and Cuyahoga County. In 2021, Hispanic adults in Cuyahoga County experienced asthma-related emergency department visits and hospitalizations at a rate of 117.37 per 10,000 Hispanic adult residents. As we transition into child data, we will notice similar trends as seen in the previous slides. Black children in Cuyahoga County experienced higher rates of asthma-related hospitalizations and emergency department visits throughout the 2016 to 2021 surveillance period compared to their white counterparts. In 2021, Black children in Cuyahoga County experienced asthma-related emergency department visits and hospitalizations at a rate of 198.25 per 10,000 residents, compared to white children in Cuyahoga County who experienced a rate of 32.85 per 10,000 residents. The rate experienced by Black children in Cuyahoga County for this year was 6 times higher than that experienced by white children in Cuyahoga County. Further looking into the Hispanic child population in Cuyahoga County, it was also evident that Hispanic children experienced higher rates of asthma emergency department visits and hospitalizations compared to white children in Cuyahoga County throughout the observed surveillance period. In 2021, Hispanic children in Cuyahoga County experienced an asthma ED and hospitalization rate of 129.98 per 10,000 residents. For these next few slides, we're going to further examine the asthma disparity as it relates to sex. Female adults in Cuyahoga County consistently experienced higher rates of asthma-related ED visits and hospitalizations when compared to male adults, both in Ohio and Cuyahoga County. In 2021, female adults in Cuyahoga County experienced asthma hospitalizations and emergency department visits at a rate of 70.95 per 10,000 residents. This rate was about 3 times higher than the rate experienced by male adults in Ohio, with a rate of 23.66 per 10,000 residents. In contrary to what we previously noticed for the trends in data, male children in Cuyahoga County experienced asthma-related hospitalizations and ED visits at higher rates when compared to female children, both in Ohio and in Cuyahoga County throughout the observed surveillance period. In 2021, male children residing in Cuyahoga County experienced asthma hospitalizations and emergency department visits at a rate of 126.25 per 10,000 child residents, compared to female children in Cuyahoga County who experienced a rate of 83.46 per 10,000 residents. This slide depicts the asthma, ED visitation, and hospitalization rates by month of admission in 2021. Data shows that there may be a seasonal trend as admission rates were lowest in the months of January, February, and March. The month with the lowest admission rate for Cuyahoga County was February, as the admission rate was 3.53 per 10,000 residents. This rate was reportedly higher than Ohio's asthma admission rate of 1.89 per 10,000 residents. For these next two slides, we will further look into the asthma hospitalizations and ED visitation rates among children and adults who are enrolled in Medicaid. This graph depicts the pediatric asthma hospitalization and ED visitation rates for Medicaid enrollees in Cuyahoga County compared to Ohio throughout the 2016 to 2021 surveillance period. In 2021, the asthma emergency department visitation and hospitalization rate for children in Cuyahoga County who are enrolled in Medicaid was 149.82 per 10,000 Medicaid residents, while the asthma hospitalization and ED visitation rate for Ohio children enrolled in Medicaid was 86.31 per 10,000 Ohio Medicaid residents. Now we are looking into the asthma hospitalization and ED visitation rates for adults in Cuyahoga County, 19 years and older, who are enrolled in Medicaid throughout the observed surveillance period. In 2021, the adult asthma hospitalization and ED visitation rate for Cuyahoga County Medicaid enrollees was 140.71 per 10,000 residents, while the rate experienced by Ohio Medicaid enrollees was 75.13 per 10,000 residents. In 2021, the rate at which Cuyahoga County Medicaid enrollees experienced asthma-related ED visits and hospitalizations was nearly double of that experienced by Ohio Medicaid enrollees overall. Lastly, we're going to take a look at the asthma disparity as it relates to mortality. Averages were calculated for the 2016 to 2021 surveillance period to achieve the reported values. White adults in Cuyahoga County experienced asthma deaths at a rate of 12 per 1 million adult residents, which was very similar to the average Ohio mortality rate of 12.17 per 1 million residents. Black adults and Black children in Cuyahoga County experienced higher rates of asthma-related deaths compared to their white counterparts. Black children experienced an asthma death rate nearly 10 times higher than the rate experienced by white children in Cuyahoga County, at a rate of 22.81 per 1 million residents, compared to 2.5 per 1 million residents, respectively. Black adults in Cuyahoga County experienced an asthma death rate at about 3.5 times higher than the rate experienced by white adults in Cuyahoga County, with a rate of 41.13 per 1 million residents compared to 12 per 1 million residents, respectively. These are some of the key findings reported throughout the presentation. The asthma mortality rates in Cuyahoga County for Black children and adults were significantly higher compared to their white counterparts during the 2016 to 2021 surveillance period. During the 2016 to 2021 surveillance period, rates of asthma-related hospitalizations and ED visits were generally higher for population groups in Cuyahoga County compared to children and Black adults in Ohio. Both Hispanic adults and children in Cuyahoga County generally experienced higher rates of asthma-related ED visits and hospitalizations compared to their white counterparts during the 2016 to 2021 surveillance period. Continued efforts need to be made in order to tackle the asthma burden in Cuyahoga County to help address the disparities between different racial and ethnic groups. ODH Asthma Program will share this information with its partners in Cuyahoga County and across the state. Resources can also be found on this website provided. These next few slides discuss some of the methodologies used for the data and calculations throughout the PowerPoint, including the diagnosis coding used to compute the emergency department and hospitalization counts, some of the age restrictions, the methods for retrieving and analyzing Medicaid data, and the age restrictions involved with that. And lastly, the ICD code pulled through VitalStats that was utilized in order to determine the asthma death counts. Here are a list of the data sources used throughout the presentation. And here is the contact information for the asthma program along with the website. And that concludes the presentation.